Reactive arthritis is an autoimmune condition where the body mistakenly attacks its own healthy tissue. This autoimmune response is the result of a triggering infection, which typically takes place in the genitourinary system or the gastrointestinal tract. For many people, reactive arthritis is self-limiting and goes away on its own within several months to a year. However, there is a significant portion of people who go on to develop chronic reactive arthritis, known as refractory reactive arthritis, where the symptoms last for years and years despite treatment, or who go on to develop consistent recurrences of reactive arthritis, which torture them every time they're exposed to this bacteria or virus that triggers the infection. In this video, we're going to explore this disease both through the conventional medical angle and through the lens of homeopathy, which is a safe, non-toxic approach of restoring health for a very wide variety of ailments. In my opinion, in order to overcome chronic reactive arthritis, we have to do two things. One, eliminate the current bothersome symptoms of joint pain and other dysfunction. And two, make the body less susceptible to being triggered by these bacterial or viral infections. In this video, I'm going to talk about how homeopathy can help with both of these goals. So let's dive in. Welcome back to the channel. My name is Dr. Andrew Chambers. I'm a naturopathic doctor who specializes in homeopathy, and I'm the founder of Whole Family Homeopathy, where I consult with clients all around the world for their health complaints. For many people who develop reactive arthritis, it's a short-term source of dysfunction and pain, but then goes away on its own, never to return. However, there's a lot of people who develop chronic forms of reactive arthritis or who continually get it time and time again year after year. Why do some people seem to breeze through it while others are left suffering for decades on end? Well, this is one of those cases where conventional medicine has some of the answers, but not all of them. For example, we know that reactive arthritis is triggered by infections, both viral, such as Chlamydia trachomatis, as well as bacterial, such as Salmonella, Shigella, or Campylobacter. We know the most common roots of these infections is through the genitourinary tract, either through an STI or a UTI, or through the gastrointestinal tract, which typically occurs through contaminated food or water. We also know that it's not the bacterial or the viral infection itself which triggers the damage to the joints, but rather this infectious agent actually triggers our own immune system to start attacking otherwise healthy tissue. And this is why reactive arthritis is considered an autoimmune disease. Now, it's this autoimmune component of reactive arthritis, or this abnormal immune activation, which causes the symptoms of reactive arthritis to persist long after the initial infection itself has been cleared by the immune system. And when reactive arthritis becomes chronic, it's because this abnormal immune activation has remained active. Now, while we don't know the full story of why some people go on to develop chronic reactive arthritis while others don't, we do know a combination of genetic predispositions and environmental factors are at play. Now, I don't typically like this phrase when it comes to explaining disease causality because it's so broad that it almost effectively says nothing. But in the case of reactive arthritis, there actually is a specific gene that's been identified as causing an increased risk of development of it, namely HLA-B27. This gene was first linked to being a risk factor for the development of an autoimmune disease all the way back in 1972. And the first autoimmune disease it was identified as being a risk factor for is ankylosing spondylitis. And now we know that there are actually many different autoimmune diseases that HLA-B27 is a risk factor for, including reactive arthritis, Behçet's disease, inflammatory bowel disease, which includes ulcerative colitis and Crohn's disease, as well as psoriatic arthritis. However, despite the fact that people with HLA-B27 are more likely to develop one of these autoimmune diseases than other people who do not have that gene, the fact remains that one, not everybody with HLA-B27 will go on to develop an autoimmune disease at all. And two, people who don't have this gene can still go on to develop these diseases, such as reactive arthritis. And the exact reasons for this variability in risk is still not fully understood. And this is where the phrase combination of genetic predispositions and environmental factors comes in. Now, conventional medical approaches for people suffering with reactive arthritis include NSAIDs, corticosteroids, and sometimes more heavy-duty drugs such as are used for people with rheumatoid arthritis, such as methotrexate or Enbrel. However, even amongst conventional medical treatments, it's still acknowledged that there is no magic bullet, especially once it becomes chronic. Generally speaking, clinicians will treat this disease based more or less on their own experience and try multiple things, hoping that one of them will work. Now, what all of the conventional treatments have in common is that they take a brute force approach to trying to shut down the body's immune system. The thinking is that because the immune system is overactive in reactive arthritis, that by suppressing it and shutting it down, there can be a significant improvement in the disease symptoms. Now, while this kind of brute force approach to shutting down an overactive immune system can be necessary at times and helpful, especially in life-threatening situations and emergency situations, when we transition it to more complex and chronic situations such as reactive arthritis, it often comes up short for people. In addition, in order to best help people with reactive arthritis, it's not enough to just improve the symptoms they're dealing with in the present. We also have to help their body not be so over-susceptible to developing the autoimmune response when exposed to the infectious triggers in the first place. Now, out of the three categories of conventional treatments for reactive arthritis, only steroids and the biologic class of drugs such as methotrexate and Enbrel actually do this to any appreciable degree. However, they don't do this by normalizing the immune system function, but they do it by overly suppressing its function. And this can be dangerous because these medications come with the risk of developing other and more serious infections. So let's talk about how homeopathy fits into this picture and why I think it can provide hope for people suffering with reactive arthritis. Homeopathy is a safe, non-toxic healing approach that has been in use for over 220 years. Ultimately, it's a way of applying substances, which are known as homeopathic remedies, in order to restore health, which is completely different from any other form out there. Homeopathic remedies stimulate our own body's self-regulating and self-healing capabilities so that it can ultimately normalize itself and return to a state of health. A way to think about this is that these self-healing and self-regulatory systems are present within each and every one of us, and they're functioning at all times. When we're healthy, it means they're functioning optimally. But when they stop functioning optimally, it ultimately results in us becoming sick and experiencing symptoms as a result. Now, whereas conventional approaches focus on suppressing the symptoms at any cost, a homeopathic approach actually looks at normalizing the underlying regulatory systems in the first place so that the body itself can correct these symptoms. Homeopathy takes a holistic approach when it comes to restoring health. As homeopaths, we focus on both the existing bothersome symptoms and the underlying triggers that cause those symptoms to occur in the first place. Over time, the right homeopathic remedy can help both of these domains, restoring health by improving the current symptoms and making us less susceptible to falling ill every time we're exposed to the same stressors. And because homeopathy works with the body's underlying systems in restoring health rather than opposing them, it does this without producing other dangerous or untoward side effects. With homeopathy, we take a comprehensive and holistic case history so we get a deep understanding of what's going on. Then we select a single homeopathic remedy that will be best able to stimulate these healing processes and restore health. We have literally hundreds of different homeopathic remedies at our disposal, and this means that we're never truly out of options after just a few tries. If you're interested in learning more about what homeopathy is and how it can help people restore health, I made an entire educational series on the subject, which I'll link at the end of this video and in the description below. Thank you for watching today's video. I really hope you found it helpful and informative. Please leave a like if you did, as that helps the channel grow and reach more people. Leave a comment with any questions you have on this topic. Until next time, I'll look forward to seeing you in the next video.